Assalamualaikum warahmatullahi wabarakatuh. Good morning, good afternoon, and good evening everyone. How are you today? Hopefully, you will always be in good health. Keep the health protocol so that the sign of spread of the coronavirus is quickly cut off. Okay guys, so group 3 will explain about the diet program. Before that, let's go to know the member first. There are Nita, Rosa, Mustika, Ratu Tiarani, Riham Suharyani, and Nuraeni. Then what are my friends who will discuss the diet program? The first is their definition of diet, the second of calorie requirement, and the last expression.
Next, we will to explain the dietary. In this material, we will discuss three main things. The first is definition, second is calorie requirements, and the last is the expression. Okay, firstly, the definition of a diet is the sum of food consumed by a person or other organism. Diet is useful for maintaining a healthy body. Besides that, diet is also useful for achieving or maintaining ideal body weight. For some people, the diet is done because they have a certain disease, so doctors recommend special rules in the consumption of food for that person. People often have the wrong perception about diet. Most people define that diet is an activity to reduce the portion of food that aims to lose the body weight. After talking about perception of diet, let's next to discuss about the types of diet with a lot of benefits from diet. So there are various types of diets depending on what benefits we want from the diet. The example diet for losing weight are high protein diet, Atkins diet, paleo diet, raw food diet, and Weight Watcher diet. The example diet for certain diseases are diabetes diet for stroke patient, heart disease diet, etc.
Now let's talk about calorie requirement. Everyone calorie needs are different according to age and gender. Look at the table. Age sedentary children 2 until 8 years. Calorie per day 1000 until 1400 kilocalorie. Active children 2 until 8 years. 1000 until 2000 kilocalorie. Female 9 until 13 years. 1400 until 2200 kilocalorie. Males 9 until 13 years. 1600 until 2600 kilocalorie. Active females 14 until 30 years. 2400 kilocalorie. Sedentary female 14 until 30 years. 1800 until 2000 kilocalorie. Active males 14 until 30 years. 2800 until 3200 kilocalorie. Sedentary males 14 until 13 years. 2000 until 2600 kilocalorie. Active people 30 years and over. 2000 until 3000 kilocalorie. Sedentary people 13 years and over. 1600 until 2400 kilocalorie. Sedentary is condition when body just do very little physical movement. Last is the expression. The first expression is offering food. So, what should we say to offer food to the patient? Can say, what would you like to have for your blah blah blah? What do you like for your blah blah blah? What do or will you have for blah blah blah? Do you like certain food blah 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 for your blah blah blah? You can fill the that will breakfast, lunch, dinner, or etc. For example, what would you like for your lunch?
Besides offering food, when we reinforce a dietary program, we need to assess patients first whether he or she has a certain allergy or not. And of course, after that, we need to explain the dietary program itself. To assess patients, we can say, are you allergic to blah blah blah? It's a certain kind of food. For example, are you allergic to shrimp? Meanwhile, to explain a dietary program, we can say, now I want to blah blah blah. We also can use I would like to blah blah blah. And the last we can use I'm going to blah blah blah. And we can add explain the dietary food that is good for your health or recommended a dietary program. And we can use explaining a dietary program. For example, now I want to explain the dietary food that can reduce your cholesterol level. Third is recommending a diet. To recommend foods or drink that can be consumed by patients, we can express, okay, you have to go on a dietary program, or okay, you have to go on the recommended dietary program. And you choose a diet program that suits to the patient's need. For the example, fruit is or are good for your health. Consuming vegetables is or are good for your health. Drinking a lot of water is or are good for your health. We can also say that you'd better consume more calories or more carbohydrate or more fruits or more green leafy vegetable and etc. To recommend a taste, we can say you may consume salty food, sweet food, spicy food, or sour food. Fourth is prohibition. In reinforcing dietary program, we are not only recommending food and drink. Sometimes we also need to prohibit patients from consuming certain food and beverages. Here are some expressions we can use to prohibit patients from eating and drinking certain types of food. First, you are prohibited to drink or to eat blah blah blah. Second, you have to avoid blah blah blah. Third, you have to restrict yourself to drink or to eat blah blah blah. Fourth, you should avoid blah blah blah. And the last we can say, you should restrict yourself to drink or to eat blah blah blah. Edit a certain or food or drink. For the example, you are prohibited to eat egg.
The fifth is telling a doctor diagnosis. To inform the patient about the doctor's diagnosis, we might say like this, well, according to doctor's report or your physician or the doctor's note, you have a problem with your stomach or digestion or cholesterol or liver or blood sugar and etc. Sometimes patients ask some rationale or reason of how they are prohibited from consuming foods and beverage. To answer the question, we may say it blah 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 contains too much or fat, carbohydrate, and etc. Consuming excessive plus certain kinds of food, sweets, rice, etc. Consuming excessive plus will worsen your condition. Consuming excessive plus will aggravate your blah blah blah. Consuming excessive plus will increase the cholesterol rate. Consuming excessive plus blood sugar. Okay, and finally, the expression is patient expression. We may say, can I or may I consume plus edit a certain kind of food or drink. And you can use can I or may I order another menu. Can I or may I borrow blah 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 the disease blah blah blah. And can I or may I have a juice and have or a menu list, have or more rice, have or more hot water. And then nurse responds, sure or certainly. So those are some expressions that we can use in reinforcing dietary program to know how it is actually used in a conversation.
Good morning, Nat.
Mrs. Nuri. How are you today?
I feel better now.
Glad to hear that. Okay, I am Nurse Jara and I will take care of you this morning. Now I'm going to check your condition.
Yes, nurse.
I want to check your blood sugar.
Okay, nurse.
Okay, Mrs. Nuri, your blood sugar level is still high. Your blood sugar now is 125 milligrams. Did you eat something?
Not yet, nurse.
Consume all of your food yesterday?
No, I didn't. I don't like the food.
Do you want something else for the breakfast?
I want a grilled fish. Can I have it?
I'm sorry, you can have it. How about salmon soup? Do you want it?
Yeah, sure.
You should consume all of your food so that your condition will get better, okay?
Okay, nurse.
Okay, I will order it for you. But before, I want to ask you, do you have an allergic to any food?
No, I don't have.
Okay, I will tell the person in charge.
Thank you, nurse.
You're welcome. See you at 9 a.m., Mrs. Nuri.
Good morning, Mrs.
Good morning, nurse.
How are you today?
I'm fine, nurse.
Let me introduce myself. I'm Nurse Jura and I will take care of you in this morning. Now, I'm here to give you information about cholesterol. Are you willing?
Yes, I am nurse.
Mrs. Nora, your cholesterol level still high now. The doctor advised you to diet. Now, I want to explain about the food that's good for you.
Okay, nurse.
You should eat seafood, fruit, and green vegetables. You should avoid junk food, egg, and skin. You are not allowed to consume alcohol, sweet tea, ice cream, and soft drink.
If I consume the food that are not allowed, what is that effect for me?
It will make your condition get worse.
Oh, okay, nurse.
Do you have any allergy?
No, I don't have.
Okay. Do you understand to the information that I give to you?
Yes, I understand.
Okay, that's all that I can explain to you. If you need something, you can ring the bell beside you.
Okay, nurse, thank you.
You're welcome. See you at 1 p.m.
So what do you think? Can you see clearly how we explain and reinforce a dietary program to patients? Hopefully, both material explanation and the role play can give you more insight and foundation of English skill in doing some nursing intervention, especially in reinforcing dietary program. Thank you for watching and see you later. Bye!